My name is Peter Propp, and welcome to another episode of Stories Behind the Science for BioCT. And today we are here with Ranjit Bindra. And Ranjit, why don't you tell us your title and your title at Yale and your title at Cybrexa, and let's go from there.
Yeah. Thank you so much for having me. So I'm a professor of therapeutic radiology at the Yale School of Medicine, and I co-direct Yale's brain tumor center. I spend about a day a week treating adult and pediatric brain tumors using radiation oncology. I also do some radiosurgery. And then I spend about 80% of my time at Yale running a DNA repair and cancer metabolism lab, focused on synthetic lethal screening and bench to bedside translation of some of our work into the clinic.
Fantastic. And how much of your time do you spend at Cybrexa versus Yale?
So I sort of like to call myself an entrepreneur on the evenings and weekends. So, certainly spend as much time as needed. We'll say substantial amount sort of comes and goes, obviously within what's allowed by the Yale policies. We're always adhering to that. But spend a very, very good amount of time. As we'll talk today, I have technically there's 5 companies I've started, and Cybrexa is probably the most advanced that we can certainly spend some time on. But there's some earlier ones as well that may be worth mentioning too.
Great. So let's roll back and start at the beginning. I know you grew up not far from New Haven in Groton. Why don't you tell us about your early days as a student and what drew you to the sciences?
Yeah, certainly. So I actually grew up in Groton, Connecticut. Was back to some folks know Pfizer was in its heyday in the 90s. That's the sort of Lipitor Norvasc days. And my father was an organic chemist. Father was an organic chemist at Pfizer. My mom also was a Ph.D. in organic chemistry. And I, really spent a fair amount of time. My mom ended up working, starting a rug shop. So she kind of left the sciences, but was working late at the business, and my dad was always working. So I was kind of left to my own devices as a child, and spent a fair amount of time just kind of noodling on stuff. And what really got me interested in science was some of you are old enough to know Radio Shack. You guys know the old you actually go and get like a PNP or NPN transistor or a whatever 10 ohm resistor. And so I got really into circuit building. So I ended up building my own alarm system for my mom's store.
Oh, wow.
Yeah, and so that's actually when I was in 10 to 15-year-old range, first kind of foray into science. And that, from there we can, continue on as whatever areas you think would be interesting. But that was my first kind of splash into the scientific world. So,
and then with all the work your parents were doing at Pfizer, you must have started to understand the impact of biotech on people's lives. When did you sort of realize that, what mom and dad are doing during the day is actually helping people?
Yeah, so it was interesting. I never really understood. I just knew my dad did a lot of stuff with chemistry, and actually there weren't a lot of physicians in our family. So I decided when I went to a public school and then boarding school for 2 years, the TAP school specifically, and there was a chemistry professor. We would sit, David Hostage was his name, and we'd sit on Saturdays and go through the problems in the quote back of the book. And it was actually a lot of fun. And between my dad's career in chemistry and his my teacher, David Hostage's kind of inspiration, I decided to go become a molecular biophysics biochemistry major at Yale. And actually there I really spent a lot of time focusing on chemistry. I was going to become a chemist, just like my dad. Bunch of my friends all were going to medical school. They're pre-med from the beginning. And my big thing was I'm scared of blood. I was like, I can't become a doctor because I can't deal with blood. And in parallel, I ended up, I had been playing drums since the 5th grade. So I got into a pretty big band my freshman year. And then, in full disclosure, since this is obviously honest stories behind the science, I actually ended up spending probably about half of my time building the band. We were a 9-piece funk band. We opened for the Indigo Girls, They Might Be Giants, and P-Funk. So we win the battle every year. And so between my MD&B degree, which was going well, had a 3.5, a decent GPA, actually technically 3.3, and I decided at the very last minute that maybe chemistry wasn't for me. I wanted to go to medical school. My grades weren't, at the best. So I, even coming from Yale, I applied to about 7 or 8 medical schools. So I said, okay, I'm just going to go into medicine. And unfortunately, didn't get into any schools. And ended up taking 2 years off at the National Cancer Institute, where I worked for a guy named Rick Klauser. So some of the older folks remember that was the NCI director in the early 2000s. And it was actually there that I met a physician scientist by the name of Marcin Linehan. We were studying kidney cancer, a disease called von Hippel-Lindau disease, or VHL, some of you may know. And I was working in the lab doing Western blots on VHL minus plus cells that I had created. And then he said, well, you want to go see some VHL patients? And I was like, what do you mean? He said, well, I see these patients. They're like right down building 10, like 4-minute walk. And I walked over with him, put a big white coat on, didn't fit me, and saw these patients. And that was the aha moment, kind of roundabout answer to your question earlier of, when did I realize it all clicked to me that I could do stuff in the lab that could directly benefit patients. And we'll get to this, where biotech comes in a little bit later. But that's kind of where everything clicked. I ended up applying to MD PhD programs, got into all 15 that I applied to, and then began my MD PhD at Yale in the early 2000s.
Great. And so what was it like when you started med school? Was it it sounds like you were pretty well prepared, but it must have been still a pretty wild experience just getting in there with all the people that knew they were doctors or would be doctors from an early age. They might have had different motivations or feelings about the field than you.
Yeah, it was a great experience. Yale was a perfect place for me. They had a no grade policy, so it was really just about motivation and doing what you wanted to do. I had already been bitten by the science bug back then from being in Rick Klauser's lab for 2 years, and so it was an incredibly exciting time. Really immersing yourself in medical school. And then 2003 or so hit when I started my PhD. So we do med school for 2.5 years, then we go do PhD. And actually my father, who was the kind of inspiration for me to do everything I'd done to that day, started having trouble swallowing and realized that he actually had metastatic esophageal cancer. He had just retired. He was in his early 60s. He put about 30 years into Pfizer, finally got this house on the water out. And so I grew up in Groton. He got this house in Groton Long Point out by the beach, which is where he always wanted to be. Moved into that house within a month or two, was given a terminal diagnosis of cancer. And that's where, again, is, the beginning of my path narrowing to, okay, I got to work in cancer, I got to work in oncology, and I need to think about, developing new drugs for patients. Still not bitten by the biotech bug at that time. It was about 2003, and I was still, trying to get my PhD done. And one of the things that will come to towards the end is the sheer speed at which academia operates of developing drugs and running them in clinical trials. Academia is incredibly important, the bedrock for a lot of these discoveries, but is incredibly slow. It actually has to be slow because just the way that it works and it's meandering. And so that's kind of, where I then began to realize that, I want to do oncology, drug therapeutics development and physician scientists, and started to realize I needed faster paths to develop those drugs.
That's amazing. So let's talk about your first experience as a in the tech entrepreneur space, the biotech entrepreneur space. You sort of got pulled into it by a professor, right?
Yeah, so it's total serendipity. I was very lucky to publish about 7 papers during my thesis years with Peter Glaser, Radon department chair, friend, mentor, collaborator, boss now here at Yale. And he was run into a meeting and said that there's something called the YES, Yale Entrepreneurial Society. Again, some of the older Yale folks will know about the Y50K competition, where you compete for $10,000 to $50,000 in cash prize, start your company. And Peter Glazer said, hey, I just defended my thesis and I was just hanging out in the lab, just doing Western blots or studying CCR5 just for fun, for HIV stuff. And he said, hey, I need to pitch this thing for a biotech. I'm trying to win this competition for this gene targeting technology that we developed in the Glazer lab, and you're working on it now, Ranjit. Could you just take the slides and pitch them for me? And I was like, I don't even know what a pitch means. I mean, what is, I didn't even know that biotechs come out of academic labs. Like I had, and it was this moment. So he gave me the deck, and I pulled in an MD, MBA student named Eric Golding. And the two of us just like started in awe, like looking at these slides and realizing that, wow, you could actually ask for $1 million and a seed round of 50,000. And in 2 years, you could be in the clinic, and you're trying to, and as I think many people on this call know, the beauty of entrepreneurship is it's a mix of salesmanship, performance, show, science, passion, art. I mean, it's everything all wrapped up into one. And so we pitched that year, and we totally lost. Okay, and excuse me one minute, just close the door. We totally lost the competition. There's a company called BioRelics that came in, Ron Breaker's company, and they came in with this, 8 people. It was almost like a, watching YouTube come out and perform a show, and they schooled everyone. And then I said, I got to figure this out. Like I got to, this is like. This is very formulaic, and actually, I think I know I can pitch and this and that. And so we spent a year working with the OCR, the John Soderstroms of the world, and Henry Lohendorf, I believe is the name, from Tech Transfer back then. And we actually turned the pitch into something real with milestones, deliverables, value inflection points, or reading about this stuff. We came the next year, we won first place. And that's where the OCR then introduced us to a guy named Kevin Rakin, who will be important for the rest of this discussion. It's this, 2005, 6 or so. Kevin Rakin was introduced. He was the CEO of Genesance, a company that folks may know in this call as well. He was just coming off that gig and was an entrepreneur in residence at Canaan. And we started a company called Helix Therapeutics on gene targeting with Peter Glazer, another guy named Jerry Vovis. Ultimately raised $6 million for that company. It was a lot to learn and swallow as a 7th, 8th year MD PhD student. I was under 30. And that company went for a couple of years. We learned a lot of key lessons that certainly we can get to through, as we continue the discussion, but a lot of key lessons that, from that first company. So.
Great. And then, I mean, the balance between the academic world, the practicing medicine, and the creation of new therapeutic treatments, it's sort of a virtuous cycle, and I assume that's really what you've been able to leverage in an important way. Not only just the fact that you're seeing patients, but the fact that when you're pitching, you can say, I saw a patient with this yesterday. Yeah. And here's why we need to fix this, because, they're a young mom, they make it personal, and people, I think, appreciate more of the opportunity to really improve people's lives. How's that been for you?
It's a great point, and it's actually I'm always I think we always, in all facets of life, we get normalized to the things that we do on a regular basis, right? We just sort of expect that to be the new norm. It's almost like weightlifting or something. You're like, okay, well, I'm going to do 2 plates, and that became, not that I do that, but And I get normalized to the fact that on a weekly basis, I will see a 5-year-old child with an incurable brain tumor who will lose their life in a year, and we'll have a family conversation that we need to pull the plug on someone who's under the age of 10. And it's actually a reminder, even during the pitches and to some of my lab trainees, that I've almost normalized that, because it is incredibly devastating to hear these stories. And when I give these pitches, sometimes I see people's body language, especially back in the pre-COVID days when we did stuff in person. You see people suddenly say, oh my God, a 10-year-old could die of a cancer. then that helps with the pitch to understand the urgency. Some of the companies we start, I mean, there's a huge unmet need. And so, back to your original question of, the three realms of basic science academia, clinical practice, and then entrepreneurship. The one thing that I've learned, it's a little off topic here, but is that there's just an immense complexity to each one of those components. And I'm, unfortunately, for better, for worse, jack of all trades, master of none. So I've more just learned to understand the immense complexity and realize that I need to connect the right people together, because I'm never quite operating fully in one space. And that has helped me immensely, because I'm actually surprised when new therapeutics are pitched and ideas are given, that people aren't thinking about some key facts on the academic basic science side or the clinical development path. And so I'm very thankful to have those experiences. So.
Right. So let's go into Sibrexa a bit, and as just a way to sort of wrap up the conversation. Tell us about sort of, the problem set you're solving. What was the key finding that allowed you to create a company, and where are you in terms of where you are with patients and things like that?
Yeah, so Cybrexa is a great story of people, and I think biotech, as Kevin Rayco would say, biotech is all about the people, and I think everyone would agree that you can have the best assets in the world, and if you don't have the right team to execute on the assets and development plan, it doesn't really matter. That's one thing I've learned over the last kind of 15, 18 years of doing this, so what happened was a couple years in the faculty, so 2015 or 16, I started back at Yale after coming from Sloan Kettering residency. 2012, I started faculty. Kevin Rayco gave me a call. We had sort of gone our separate ways. He went and started Advanced Biohealing, sold that company to Shire for $750 million, and then started High Cape. And he said, let's get coffee at Blue State. I still remember the conversation. We got coffee on Blue State down by the Anlin Center. And he said, how's faculty going? I said, good. He said, have you thought about something new to start a company? He said, geez, I've been so focused on trying to get my first R01. I didn't even think about starting a new company and whatnot. And he said, well, what's interesting to you? And I said, well, tumor targeting is something that we need to do a better job at. We have ADCs, we have all these other synthetic lethal therapies, but there are these peptides that target the low pH tumor microenvironment. And there's a guy named Don Engelman and Jana Retzlack and some other folks, but Don Engelman, biophysics professor who was actually my teacher at Yale undergrad, teaching my class, was developing this flip technology, pH low insertion peptide. And that technology was available to license. And we came up with an idea of, could we target the cancers with either DNA damaging agents or DNA repair inhibitors, and it targets the low pH of the tumor microenvironment. So I pitched the idea to Kevin. Peter Glaser again came back, and he was really one of the drivers of this idea. And we sat down, we said, okay, we got a really good team, Peter, me, Kevin, we need a CEO. And we found a guy named Per Hulson, who was just coming off another business himself that he had sold. We came together with some other folks, raised some money, in-licensed that technology from Don Engelman and Jana at the University of Rhode Island, and Don's obviously at Yale. And what was exciting about that was literally it was just an idea. We got $6 million, and we just had a shared workspace at the Grove down on Chapel Street. Sure. And just sketched out ideas on how to start a company. Long story short, there we got about 10,000 square feet at 5 Science Park, completely empty. I came in with Per, and the two of us basically built the company, recruited the entire scientific team that many of whom are there today, filled up the lab, and fast forward now, we've raised. We'll have hopefully raised about 70 million by hopefully this quarter, about 50 million so far, another 15 coming in, and we're now in the clinic. So that was 2016. So we're 2022, and we have treated a number of patients. One which we've had a press release on has had a complete response to the therapy, and so now we're thinking about what's our exit strategy. Again, learned immensely from that. And in the time that we have left, happy to think about any focused questions that you may have around Cybrexa. So,
yeah, I mean, if you could just maybe in layman's terms, since we have scientific people here, but they're not exactly in your field. Talk about the way Sibrexa actually operates.
Yeah, so the company itself is
the science. Yeah.
the technology great. Yeah. So the science is interesting. It's a fascinating, it's a small peptide that has aspartates, which are these amino acids that when the pH gets low, they get modified. It's called protonated, or they become modified in such a way that the structure of the peptide becomes like a corkscrew. If you think of that going into like a wine cork, and that burrows across the cell membrane and drags any drug that you want into that cell. Now, the beauty of that is low pH is a common feature of cancers. If you think about PET scans and a lot of imaging that we do for cancer, cancer cells are always rapidly dividing and constantly consuming energy, and that decreases the pH all around the tumor. It's something called the Warburg effect. And this is really a consistent feature of many cancers, solid tumors. And because of that low pH, these peptides can be used. You inject them in the IV in the patient, and that peptide, as it circulates and it gets close to a tumor, those aspartate residues, they get modified at that low pH, and the thing goes from a floppy kind of spaghetti noodle into a corkscrew that drills into the tumor cell. What I always love to say is the most crazy thing about this is that it actually works. There's been about 80 papers on it published academically. But then what Cybrexa did is we built a whole collection of animal models to show exactly how it works, pharmacokinetics, pharmacodynamics. And then we designed a really killer phase 1 clinical trial. And again, this was what was great, is being able to leverage some of my experience with working with the team, where we actually designed a trial where we biopsy the patients prior to treatment and then on treatment and ask that question: could you detect the drug in the tumor? And could you detect the cleaved form of the drug, suggesting that that corkscrew event happened? And so it's been really exciting because the technology is really working in patients. But that's sort of how it is at a higher level.
That's great. Really, really exciting. Well, I think we've really covered you from your days building stuff at Radio Shack to solve a problem for your mom, to a very exciting way to treat solid tumors. And I wish you all the success in the world. I'm wondering if you have any thoughts for, today's young students as they look at a career in biotech. Any thoughts, any areas that you think are more exciting, or any ways to focus efforts?
Yeah. I think that what I message to the younger folks is, biotech is unbelievably exciting, and think about exactly what you want to do first and how you want to do it. Do you want to be a scientist? Well, then think about the grad school route first. Do you want to be a business person? Then think about the MBA first, and go, and you'll be surprised. What I love about the New Haven biotech entrepreneur community is we're all very collaborative and open to mentorship. And I really only hear in the biotech world because of the mentors of my past, John Soderstrom, Kevin Rake, and other folks. And so I think it is a hot time. I'm obviously biased to cancer, but I think immuno-oncology, synthetic lethality, DNA repair, cancer metabolism, there's just going to be a whole other wave just coming once we get out of this pandemic. I know the IPO season's a little rough right now, but it's going to flip right back. So it's a great time to do startups and get involved early, because it's a lot of fun.
Excellent. Ranjit, thanks so much for your time today. I really appreciate it. And we'll see you around New Haven.